While acupuncture offers the promise of that fix with an ancient practice, researchers have also tackled this problem with modern technology and electricity.
I knew that it's possible to stop pain electrically. The brain and the spinal cord are a heck of a lot more plastic than anybody ever thought, particularly the brain. Trying to capitalize on that has been extraordinarily difficult.
In 2009, Dr. Smith got a call about a device that leverages the nervous system's inherent plasticity for pain relief. It's called Calmare, or Scrambler Therapy. It's a therapy for treating neuropathic pain.
Chronic neuropathic pain is just demoralizing. It just takes your energy away and keeps you from living a normal life.
What I feel like was all the joy of life was taken away because basically I was in pain 24/7.
Scrambler therapy works through a series of electrodes on the skin near an area that is experiencing pain. The electrodes send a signal along the entire nerve pathway back to the brain.
Electrodes on the skin send a non-pain signal up your native nerves to your spinal cord, connect to that second cell in the spinal cord, and then up to the third cell in the thalamus and over to the other side of the brain. And it would replace the pain information with non-pain information. And it sends a signal that to me feels like being bitten by electrical ants. It's constantly shifting.
So you'll never get one sequence repeated. Now, the importance of that is that the brain can't accommodate to it. The brain gets that message and it allows the brain to break that pain pattern.
Dr. Smith's first Scrambler therapy trial studied 18 people with typical chemotherapy-induced neuropathy.
The pain scores went from 6 on day 1 down to 2 at day 10. These people had had no relief from anything else. So we thought we were actually onto something.
Scrambler therapy is not widely available yet. When faced with debilitating complex regional pain syndrome, Cal Ureski did his own research and decided to give it a try.
I did research. I had nothing to lose by trying it. Our nervous system has memory. So what happens from this is you can get an injury to the nerve system, and you'll feel the pain initially, and now your body remembers it. What things like Scrambler Therapy is designed to do is it sets your pain system's memory, your nervous system, back to zero. And as long as you've gotten that therapy and it's worked for you, if you maintain the therapy, it keeps that complex pain from coming back.
What we've seen is sometimes you put this on and 15 minutes later people will say, this doesn't feel as numb anymore, and I can actually press my finger. I've been able to do that for 3 years. What did you do to me?
Dr. Smith told us that not everyone is wired the same way. This is why having a toolkit approach is essential, because pain is subjective. Not every person responds the same to every therapy. But each therapy gives you another pathway, another shot at relief.
About 10 or 20% of people, when I put the machine on, absolutely nothing. There are another 20% who get some relief, but not a whole lot. The other 60%, I think, get pretty substantial relief.
In the first session, Dr. Cooney said, "How does that feel?" I said, "I feel like I just put my finger in the socket, but I feel it moving through my leg. I feel there's a change there."
Pain is a warning signal. That's important. There are instances, though, where it can malfunction. What we want is to reestablish to the brain and allow all of the functions to be predicated upon real information. Because when you get that type of loop in the brain, it's not predicated upon real information.
By the time Dr. Cooney got through the third or fourth session, I started to feel relief. And then by the time I did the 10th session, the relief was in place and I felt great.
Some of our patients had their pain go to 0 literally to zero, and stay that way for weeks or months at a time.
The results were astonishing. Even Dr. Smith was surprised.
The best medical management pain scores went down by 28%. Our group, the Scrambler Therapy group, went down by 91% at a month.
On a scale of 1 to 100, this is at least an 85% improvement in my life. But the pain's gone, and that's what Scrambler Therapy does.
An 85% improvement in life sounds incredible for anyone suffering from chronic pain. Substantial relief is within reach when we work with all the pain secrets.